am Dr. Allison Felt, and I am the owner of Body Motion Physical Therapy. We are located here in Edmonds, Washington, but we see clients all over the state. Our focus here at Body Motion is really helping moms through pregnancy, really optimizing their bodies so they can have pain-free pregnancies, continue doing everything that they want to do, and really optimize your body for the birth that you want. So a lot of moms come to us because they want to try and have a vaginal delivery, or maybe a vaginal delivery after a cesarean. And so they do a lot of work with us to help prep their body and optimize themselves, right? So that's a lot of what we do. We also do a lot of recovery postpartum. So we are firm believers that everybody deserves prenatal pelvic floor physical therapy before pregnancy, and seriously need it after pregnancy. So our mission is to really spread awareness of what is possible and what should be done. And this is welcome to your pregnant body. So thanks for attending with us. But also know that we do complimentary virtual visits, intro visits, so where we can really get into like what kind of birth that you're hoping to have, whether that's a birth center birth, a hospital birth, whatever you're aiming for. We can help guide you and kind of talk you through some of your potential plans for the rest of your pregnancy to help give you the outcome that you're looking for. So we're gonna start the webinar with talking about anatomy changes, so things that are happening with your body during your pregnancy, and a little bit of some corrections so you can help mitigate some of the changes that can cause other issues. We're also going to talk about core and posture and some important body mechanics. So we'll go through some sleeping positions that will help optimize your body, and just some little things like getting in and out of the car to really make sure that you're protecting your joints, protecting your pelvis. We're also going to talk about the pelvic floor. We're pelvic expert physical therapists. We deal with the whole body though, but what people don't tend to think about when they are preparing for delivery is their pelvic floor. So I'm going to spend some time here and just tell you really what you would want your pelvic floor to be able to do to be ready for your birth. And then we'll talk about some daily rituals and some prep activities that you can do for birth. And we'll also discuss some postpartum healing times, some normalcies that you can expect. Cool. So I'll start here with a general posture. So typically throughout pregnancy, this is going to progress as you go through your pregnancy. Obviously, your chest is going to get bigger and your belly is going to get bigger. So what that tends to do to us is it tends to pull us forward. We tend to become more kyphotic, so hunched over, and our head comes forward. So it's kind of like that computer desk posture, but that tends to stay with us as we go through pregnancy. So what that looks like here is kind of a slouched posture, so you can become kyphotic. And then a lot of times as the belly gets bigger, it really can pull your whole back and make it into an extension or lordotic curve. And also the pelvis just tilts forward. So the number one thing that you want to learn how to do to protect your body for your posture during pregnancy is actually learn how to activate your lower abdominals. And what this is going to do, this is called your transverse abdominal muscle. What this is going to do is it's going to help keep the muscle strong as your belly gets bigger. So it's also going to prevent, if you've heard of a diastasis, so that's a separation of the two six-pack ab muscles. Okay, so it's going to help keep that approximated so you're less susceptible to getting a separation. So this is something you can do prenatally to really prevent a lot of separation. Some separation is going to happen, but you want it to be strong and create a lot of force here. So teaching yourself how to activate your lower abdominals is going to be key in protecting your body throughout the remainder of your pregnancy. So if you're in this position, and you might find yourself as you get bigger going more forward, with the correction is simply to hug your baby or pull your baby in with your lower abdominals. That might cause a little bit of a tilt in your pelvis, and that's good. So you don't want to be back here and tucked. You really want to be neutral. So if I was going to drop just like a fishing line from the top of my head down, my ears would be over my shoulders, which would be right through the middle of my hips, and I'm all in line here. Okay, so what's guiding that whole posture sequence is that lower abdominal, so your transverse abdominal muscle. And so hopefully throughout that demonstration, maybe you guys tried it too, and you could feel yourself be able to pull the baby up and in without using your hands, but just using your muscles. And that will help start activating your lower abdominals. So that's going to be key in your posture. So that's the posture correction. So really start the correction with pulling baby up and in. Now, if you have a individual session with us, we might change this a little bit so it's really specific to your body. Everybody's body is going to be different. So it is absolutely important that, but that's just a good starting point. So it might not, we reserve the right to change that for your specific body and what you're experiencing. But that's just a good starting general point here. Cool. So I'm going to go on to the next slide. All right. So as the abdominal wall gets bigger, so as you grow, baby gets bigger inside you, the muscles are lengthening. And what that does when muscles lengthen, they become weaker. So they're not as supportive. So when we're talking about the lower abdominal muscle, we really want to start activating that muscle so it stays strong even as it's stretching out. What this is going to do is it's going to help you rebuild your core postpartum with much more ease. So if you were activating that muscle throughout your entire pregnancy, it's going to allow you to learn how to activate it postpartum. What we see, and I'm going to go on a little tangent, we end up seeing moms that come to us in their 40s and 50s who never healed after birth, and they'll end up spending 15, 20 years not activating this muscle. And if you're not activating this muscle correctly and along with your pelvic floor, then you can end up with a lot of joint pain down the line. Sometimes this leads to hip and knee replacements because this muscle is a key part of your core, the lower abdominals, along with your pelvic floor. So knowing how to activate those after birth is going to be much easier if you learn how to activate them throughout your pregnancy. Cool. All right, diaphragm. So the next muscle I want to just touch on, so you know how to activate. You learned about the lower abdominal muscle. Now we're going to talk about the diaphragm. The diaphragm, so if you think about your rib cage here, okay? So rib cage, hopefully you can see that okay. Rib cage is going to widen and expand in order to make room for the baby. Sometimes this ends up showing up as like rib pain in pregnancy, but not always. But no matter what, ribs expand. What that does is you have this muscle underneath your rib cage. It's called your diaphragm. And the diaphragm then becomes longer. And again, just like your lower abdominals, that muscle becomes weaker. And so it's really imperative that you keep that muscle, your diaphragm muscle, strong throughout the entirety of your pregnancy. And so some women express that like they become breathless during pregnancy or like as the baby gets bigger. And that's simply because you're running out of room for your lung expansion. So the diaphragm is responsible for your lung expansion. So I want everybody to follow me here. You're going to put your hands on your belly. You are going to, okay. So you're going to put your hands on your belly. You're going to take a nice deep breath into your belly and let it go. You might pull some air more into your chest. Your chest might rise. And okay, so what you're doing there, when your belly is expanding, you might get some lateral rib rising. What you're doing there is you're activating your diaphragm. You're training your diaphragm to work. What ends up in pregnancy is as the baby gets bigger, we tend to breathe really shallow and just use our chest for breathing. But what's really important is that we're going to get to the pelvic floor, but the pelvic floor is going to follow the muscle of your diaphragm. So the daily ritual here is to do 5 minutes of nice, deep breathing every day. Because what you're doing is you're activating your diaphragm and you're training your diaphragm to go to contract and go down into the belly, okay? What this turns into is that during labor, when you're dealing with contractions, You can use the diaphragm if you know how to breathe and you've been using it through your pregnancy. You can use the diaphragm to help. Not only just it kind of pushes down on the uterus, which is nice during contractions, because then you get a little extra oomph on that uterus, which is contracting to help open the cervix. So you've already trained your diaphragm. So the breathing is in order to train the diaphragm, which is going to help relax the pelvic floor, going to keep part of the core strong during pregnancy, but is also going to help you during your labor and delivery, manage contractions, and also for pushing. And we'll get to that in another slide when we talk about the pelvic floor itself. So if there's one thing that you learn how to do here, I hope you learn how to breathe. I'm going to tie this into things later down the line, but breathing and really using the full range of motion of your diaphragm, whatever your range of motion is. If your baby's really high up, it might be harder for you, but as long as you're attempting and trying that, that's beneficial. So some of the pelvic changes that happen during pregnancy, I'm going to talk about that here. Let's see. So I have a pelvis, okay? Here is the front of my pelvis, okay? This is the back side. So if I turn around and show you my butt, you'd see the back side of the pelvis, okay? So front side of pelvis, you have this joint right here at the front of the pelvis. It is called your pubic symphysis, and at that joint, you get about 5 to 7 millimeters of separation throughout your pregnancy, and then up to 9 millimeters separation during delivery. So it spreads pretty wide here, and it's pretty incredible to look at someone with an X-ray right after they deliver. It's hugely gapped here. So what this means for the body is that, number one, these can be sources of pain. So you can have pain at these pelvic joints. Pelvic pain at the SI joint, this is a sacroiliac joint, would be like low back pain or one-sided low back pain. Some people experience it as hip pain. That's the words they use. Some people experience pubic symphysis pain as like a sharp knife, feeling like they have a sharp knife in their vagina. So with these pelvic expansions, so with everything spreading and getting wider during pregnancy, what ends up happening is the muscles that they tighten and they try to hold your pelvis together, which in and of itself can cause its own hip pain and its own low back pain, its own SI pain. So everything tries to tighten to secure the pelvis. So this is where we run into issues, because the pelvic floor, we want it to be opening, not tightening. And so sometimes that takes specific training and specific effort in order to teach the muscles to elongate and open. And same with the glute muscles, everything that you would think of in your butt, okay? So all of these muscles that go in on the backside, that attach to your sacrum, they just tighten down so much in order to hold you together and help bring you to the end of pregnancy. But what we really find is so helpful is teaching those muscles to relax, not just by stretching. Stretching is wonderful, but using actual massage techniques to help open the pelvis, and different other tools to help open things up to prepare the body and the pelvis for birth, along with training the pelvic floor. We talked about the pelvic floor is elongating. So the pelvis is trying to widen here to prepare for birth, and reactively everything tightens. So a lot of what we do is opening, and we'll go through that too. So I'm gonna go to the next slide. Cool. So now we're gonna get to some more functional stuff that you can just start right away. These are different techniques to help modify your body mechanics. So we're going to talk about, and this is really important to help protect your joints, because your joints are spreading, everything is looser, you're more susceptible to getting pain in the pubic joint, getting pain in the SI joint. And when you have pain in these joints, it makes it even harder for the pelvis to want to open for birth. So it is important to deal with the pregnancy pains so the pelvis is able to open more for birth. So if you are experiencing some pain, it's important to find ways to mitigate that, like pelvic floor physical therapy. Not that I'm biased. But so getting in and out of the car here. So if this is my car, let's say you can see me here. All right, so here's my car. A lot of people just have a tendency to step into their car, okay? And what we want to do is, especially as you progress through, I would say start this like it probably second trimester really is when this is going to be really important to start implementing, is instead of just stepping into your car, you're going to pull baby in, you're going to sit down in your car and then walk your feet in the car. The reason for this is we don't want to put asymmetrical force on that pubic symphysis joint. So we want to keep our legs together and do things more bilaterally, so together. So we're not putting like a strain just through one side of the joint. That can cause shifts in pubic bone alignment, which can increase pain, increase inflammation there, and that can be really hard to resolve during pregnancy and can linger through postpartum. So that's getting in and out of the car. Sit down first and then walk one foot in. Obviously, if you have an SUV, it's going to be a little different for you. You might have to, if you have like a step into it, you'll have to step and then pivot and then sit down. But you can play with that. The idea is that you pull baby in, keep your feet together, and so you're not just like on one foot and on the other. I hope that makes sense. Drop questions in the chat if you don't, and I'll get to those at the end since I can't see it right now. So sleeping postures. Sleeping postures are truly important throughout your pregnancy, because what you want to do, obviously you want to be able to sleep first off, and second off, as you get closer and closer, it can become more uncomfortable. So having really good postures to support your body and not wake up with new aches and pains, or having your butt just like sharply ache in the middle of the night. That's a common symptom that people describe. So what's really important is being able to keep your skeleton completely aligned and stacked, just like we did in the posture correction. So being able to keep your skeleton aligned when you're sleeping. So what that looks like is, here's my bed. It looks like having a supportive pillow, so your neck isn't cranked up, it isn't cranked down, okay? This is a little drastic, but I can barely see myself. And then you want to be supported with a pillow between your knees. And you guys might be asking, like, what about the body pillows, and what about body pillows that go up and all the way around? The goal is that you maintain that same alignment, so nothing is cocked up and cocked down, and you're not rotated heavily forward, and you're not rotated heavily back. The reason the pillow between the knee is important is because if your knees drop together, you're going to get more torsion and rotation through the pelvis, which is going to set you up for more pain. Because these joints are so loosey-goosey, spending all night in an unsupported position can actually cause some pain, be a little harmful. So it's important that you are set up that way. The other thing that I didn't show is they also make belly wedges, but you don't really need a belly wedge. You could just grab a towel, grab a little support here, and you would stick it under the side of your belly as you're sleeping. So I would say you start this right when you start to show. The reason you support the belly is so the belly doesn't pull you forward, okay? So that's a good sleeping posture. People sometimes ask, like, well, after I deliver, I don't need to sleep in my pillow palace anymore, right? And really the answer is, as your skeleton is coming back together and things are still really loosey-goosey, you want to support your body as much as possible and sleep in an aligned position. So toileting postures, I'm going to save for my favorite slide, so we'll get to that. And then sitting postures. So a lot of people sit in postures that are crossed legs. So maybe you cross your legs or you just cross your heels, especially as things get bigger and more uncomfortable. You might be wearing dresses and cross your legs for a courtesy. But really good mechanics and to keep your pelvis and your spine aligned is to think when you're sitting that you have 2 fist widths between your knees and 2 fist widths between your feet. This is going to set your hips up in their sockets just perfectly. And you want to be sitting on your sit bones. So if you're really rolled forward, you'll be sitting on your pubic bone. And if you're really rolled back, you'll be stressing out your lumbar spine and your back joints. So ideally, you'd be supported sitting on your sit bones with 2 fists between your knees and your feet and not crossing your legs. So those are the recommended sitting positions. Okay, I just got a question. Okay, I'm a back sleeper and recently just started putting a pillow between my knees. Oh yeah, awesome, good. It does make all the difference, and make sure you're supporting yourself with that pillow or towel roll underneath your belly too, just so you can't roll forward or to the side. Cool. So now we're gonna talk about my favorite part, pelvic floor. This is what you guys are all here for, right? So this is your pelvic floor, okay? Pelvic floor is 3 layers of muscles, which are composed of more muscles, okay? And some soft tissue and some fascia, okay? So this sits as a bowl inside your 2 hip bones, okay? Your pelvic floor encompasses your anus, your vagina, your urethra, your clitoris, so whole vulva area. The pelvic floor, if you were planning to have a vaginal delivery, the baby is going to come out of your vagina, okay? And we want it to just be that. We don't want to have any tearing through anywhere else. So I want to teach you guys, this is a huge thing. It's a huge mission of Body Motion, is to really teach people how to have vaginal deliveries and have minimal, if any, tearing to the best of our ability. Sometimes baby's in a crazy position and there's nothing we can do about that. But the fact is that you can prepare your pelvic floor and optimize it so it can be ready for these positions in birth. So the anus obviously is for bowel movements, vagina, sexual function, urethra is urine, okay? So the pelvic floor is responsible for peeing, pooping, and sex and orgasm, okay? And so what happens with the pelvic floor here is with that pelvis separating, so the whole pelvis opening, right? You're carrying a baby, you're getting ready to open your pelvis, everything's loosey-goosey. What we see most of the time is that the pelvic floor is just compensates and tightens. So things tighten. You end up seeing a lot of people with hemorrhoids and anal fissures during pregnancy. And a lot of that is not just due to constipation or integrity of the stool, but it's also due to the fact that things are just so tight that they can't really get out. So what we preach is really just teaching people how to open their pelvic floors. So that is the reverse of what you think a Kegel would be. So pelvic floor here, I'm going to explain it as a bicep. Okay, so if this is my bicep, my arm, I can lift things up. But if I was constantly walking around with my arm in this position, it would be extremely weak. It would be extremely tight, and I couldn't lift much, okay? And then there would be no point for me to do bicep curls because all I would be doing was trying to curl here. And this is pretty much what we see happen with the pelvic floor. The pelvic floor ends up living here because most women aren't taught to relax their pelvic floors and therefore have a really hard time being able to open their pelvic floors, nonetheless push out and overextend it for birth, okay? And that overextending is actually also what needs to happen for a really healthy, happy bowel movement. So part of what I'm going to go through in this lecture is how to have a really good bowel movement and how you should be, every bowel movement should be training you for delivery, okay? So, so most women ask, like, should I do Kegels to prepare for pregnancy or prepare for birth and like help through the pregnancy? And the answer is, if your pelvic floor is this tight, no, that would not be the place to start. The place to start would actually be breathing, okay? So if you remember back from early on, when you are in the, when you're taking deep breaths into your belly, so using your diaphragm for expansion, if you imagine, I'm going to have you draw your attention to your anus and your vagina. So go to both and you're going to decide which one you can control better. You're going to imagine that that is a rosebud. And then on the inhale, you're trying to open the bud and flower it so we can see all the petals. So that's one analogy that works for some people. So you think about inhaling into your belly, drawing all the air down towards your anus, and that is opening, okay? So that you should be able to sense that and feel that. Sometimes it's easier to do if you're sitting on a physio ball or an exercise ball, so you can feel that happening. And then you can practice squeezing just so you can sense the range of motion. So for delivery, your pelvic floor has to be able to not be in this contracted state, but has to be able to relax and then overextend and open. I want to say, I'm going to spend some time here because this is really important. A lot of times what we see is moms who are in athletics, moms who are hyper flexible, moms who grew up as a gymnast, dancer, or lifting a lot of weights, maybe CrossFit. What we end up seeing is that these pelvic floors are so tight. You are so used to contracting and working your muscles that it's really hard to go through the full range of motion. Symptoms that occur with really tight pelvic floors are incontinence. So a lot of times people are like, I'm peeing my pants, I better Kegel. And that's just a lot of times making the problem worse. So what we really know now is that we have to teach the pelvic floor to open. And that's how you get the best function out of your pelvic floor. It sounds counterintuitive. But moms who come to us when their pelvic floors are so tight, it almost feels like, and I'm going to be graphic here, and I'm sorry for anyone if this is too much, but it almost feels like it's beef jerky. And it's a dehydrated, unhealthy muscle that's not able to relax, contract, or extend. And so that's what we see. What we want to have happen is we want that muscle to feel like a juicy steak. We want that muscle to be able to be a nice muscle that has blood flow and that can open and move dynamically. You can test this yourself by laying in bed, stick a finger inside your vagina, see if you can squeeze, relax, and bulge. Okay, so you should have those 3 range of motions, and they should happen rapidly. You should have rapid control, so it's quick. And so I put in here some squeezing techniques, and I'm telling you, just relax. Don't do the squeezing part of it. And really, I would say that the relaxation, the opening is 99% more important than these contractions. Sometimes we have people do the contractions only so they can sense themselves relaxing and opening. But it's really essential that you can learn how to get that relaxed position. So really work on practicing the breathing, pulling it down into the pelvis, and being able to open the muscles and open the pelvic floor. So that's where you're going to get your best bang from your buck, or whatever the saying is. That's where you're going to get the best bang for your buck as far as pelvic floor preparation goes. And yes, that is the bulge. So is the bulge function the overextension? Absolutely. Yep, that is exactly it. So contracting, relaxing, and bulging. Thanks for clarifying that, Kelsey. And the bulge, sometimes I describe the bulge as you're trying, you have to fart, but you don't want anyone to see you fart. So you're not like squeezing it out, but you're just like, whoop, let it go a little bit. And that's a bulge, okay? So that's how I describe the bulge. So the other thing that I have on here is some delivery positions. So really that's up to you. If you have an epidural, there are, you're kind of bound to the bed. There are sometimes I'm losing my train of thought on what it's called, the bar that you can prop yourself up on so you can kind of squat the baby out, even if you have an epidural. There was the trapeze. And so that's an option, but what you want to practice is different positions. So whether that's you're on all fours, I'll kind of go into some common positions here. So whether that's like a half kneeling position here, okay, or if you're on all fours here, or if you're in a squatting position, some people want to squat. You want to make sure, and this is a lot of what we test in the office as well, is we test the dynamic control of your pelvic floor in all those positions. So you want to have the utmost control while you're in those positions. And you can just feel that yourself, see where you're sensing control. And a lot of times people do have a hard time figuring out that relaxation and opening piece. Even if you feel it, it might not be to the extent at which it needs to, but the best thing to do is to start feeling it. And then the other best thing to do is to see a pelvic expert physical therapist who can really assure you that the quality of the muscle, so it's not beef jerky like, so that is, it's a healthy muscle, a dynamic muscle that can open and really help prepare for the birth. So I hope that was helpful. The one time where it is important to teach your body how to Kegel is with coughing and sneezing. So anytime you go into a cough, you do want to be able to contract. That's like the one time where we do suggest that the Kegel should happen. Like that just should happen. You should focus on contracting in order to cough or sneeze. So that is something you want to train. But again, if you don't have a relaxation, it's really hard to feel the sensation of the contraction. So I'm going to go to the next slide here. Maybe. Okay, cool. I think I'm on this one. Let me just go back. Okay, happy and healthy bowel movement. So what we teach all of our patients to do during the pregnancy is every bowel movement is practice for delivery. So I'm going to teach you guys how to have a healthy, happy bowel movement. If you've heard of a squatty potty, that is the best position to get your legs up onto something. So that's like a stool like this for your bowel movement. But if that's not available, some people find that leaning forward or kind of rocking back in this position helps them get the stool out while breathing the stool out. So we want to say that the integrity of your poop, just as in your delivery, you want to be able to breathe the stool out, okay? We talk about breathing the baby out too. So the stool, the bowel movement technique that I'm going to teach you, this is the preparation technique for your pelvic floor. Oh, thank you. Okay, I will turn that light on there. Hopefully that's better. Okay, so if you're in a bent over position, this is how you practice your bowel movements. You're going to do 3 nice deep breaths here. So 1, on every breath, you're pulling the air down to your anus, down to your vagina. Focus on opening and opening again. On the 3rd one, you hold the air in, you keep the air in, and then you do a bearing down or a bulge. And again, this is you have to fart, but you don't want anyone to see you farting. You're not like, trying to get it out. Yeah, I did that. You're just gently trying to open, okay? So that is a healthy bowel technique. And every time, I'm going to take this a step farther, and you should use some visualization. Every bowel movement, every time you go and have a bowel movement during your pregnancy, I like to think of it as like every bowel movement is training. And if you think about like the baby actually descending, visualizing, seeing the baby descending through your vagina with every bowel movement, that's just practice. Then your body all of a sudden knows like, oh yeah, okay, my brain saw the baby coming through, and now I'm ready for that. I can implement that and recreate that when I'm in labor. Cool. So that's the bowel movement. Any questions on that? My screen is still being shared. We're good, but it's not moving. Okay, here we go. So some rituals for birth and some daily rituals to help prepare for birth. So some people are really into yoga, some Pilates, boot camp, all that kind of stuff. And it doesn't matter so much what you decide to do. It doesn't matter what you decide you do for your exercise. What matters is how you're doing it, okay? So your ability to use your core to protect your body is so essential. So even if you want to keep going to CrossFit, even if you prefer yoga, it really matters that you know how to use your muscles so they're supporting you during your pregnancy as your body is changing so drastically. And like I said, like some of the exercises like Pilates there's a lot of ab work, so that can predispose some people to ab separation during pregnancy. But if you know how to use your pelvic floor and your lower abs correctly and your diaphragm, you can really help keep your core nice and strong throughout the entirety of your pregnancy. And same thing with like boot camps are fine, but high impact exercises like running and jumping and some plyos or jump roping, so plyometric exercises that are more ballistic in nature, those can just be harder on your joints and harder on your organs. Your uterus is heavier, so it's going to put more pressure down on your pelvic floor. And other than birth and delivery, we don't want your uterus coming out of your body. We don't want your bladder or your rectum coming out of your body. Those are called pelvic organ prolapses. So we want to do activities that help support and keep things inside your body. And when your ligaments and joints are more loose because of the hormone relaxin, that means that your joints aren't as good at stabilizing really high impact movement. Now, like everyone always says, okay, well, I was doing it prenatally, so I can just, or I was doing it before I was pregnant, so preconception, I can just keep doing it now. And absolutely, like that is the way of the world. However, just to optimize your body to protect yourself, we really suggest like making sure that you know how you're protecting your body and how you're using your core, so that all those exercises can just be safe for you. And a pelvic expert physical therapist would be able to help guide you through that and make sure that you are doing everything okay to protect your body. And then I also put on here body work and manual therapy by a pelvic expert physical therapist. This is pretty second to none. And a lot of what Dr. Elena and I are working on and about to start collecting data on so we can get some research going is the importance of changing the pelvic floor from that beef jerky-like structure, from that tight pelvic floor, even if it's not beef jerky, but it's just super tight, changing the integrity of the muscle so it's soft and fluffy so it works. So a soft and fluffy muscle is so much easier to use, and it's so much easier to have that range of motion than having like a hard, rigid, tight muscle. And so that's where a lot of importance comes through as far as getting work done on your glutes, opening the pelvis, getting body work done through your pelvic floor. So it's safe and indicated as long as you aren't on pelvic rest. So if you're on pelvic rest, where you're not allowed to have intercourse, maybe because it's high risk or you're bleeding, then you wouldn't be a suitable candidate for that. But if you're not, I highly recommend it. It's a game changer, and that's really what we're seeing. Okay, cool. So someone asked a question. So no burpees. Burpees can be fine if you're doing them okay. It's really about your breath patterns. So, so you're not like holding the air in and bearing down throughout the burpee, but it's it's breathing through the pattern, being able to make sure that everything is pulled up and in. How can you tell if you're beef jerky or steak? I love it. Thank you, Terry. That's amazing. So really from a internal pelvic floor assessment, and you can feel your own pelvic floor too. So a lot of people will. And a lot of people, when they talk about stretching pelvic floor, and you might hear perineal massage, that's talking about just doing these superficial muscles, so stretching these superficial muscles. Where we really find a huge difference happening is when we go into all the layers of the pelvic floor and address all the muscles. And a pelvic expert physical therapist would be able to guide you to doing your own myofascial work and your own muscle releases, but also be able to tell you kind of how those muscles are functioning for you. That'd be your best bet, but you can definitely like try it yourself and kind of like see where you are on your own body. Okay. Oh, I skipped it, but lacrosse ball release. This is just a technique that I'm going to show you guys. Okay. So I like this as far as a pelvic opener. So taking a ball, using it against your glute area. Okay. So 1 to 2 minutes, and rubbing it against the wall. So you have the ball, you stick it against your butt, which is against a wall, and just do some soft tissue release. We have that move on our YouTube channel, and you can check that out too. And maybe we'll put that in a recap on an email to everybody. But that is an awesome release to help start opening the pelvis from the external muscles. So those would be like your glutes, because this tightens down a lot back here. Because this joint is opening, you're trying to get stability somewhere. So we see a ton of glute tightness, and you might notice that like, someone just touched my butt or whatever, and it felt really tight or painful just to like a little bit of touch. And that's not normal for you. The other thing I'm not going to go into too much, but during pregnancy, your feet expand. We definitely recommend orthotics during pregnancy to help prevent feet expansion. There's also different foot strengthening exercises you can do to help maintain your arch and maintain your integrity of your foot so you don't get a lot of spreading. But a lot of women will say they go up a shoe size. But you can prevent this. So if you keep your feet strong and use a good supportive shoe and orthotic, that can really help maintain the integrity of your arch, which is awesome. And we have flip-flop orthotics here, which is my new favorite thing. So for my maybe next pregnancy, if that's ever happens or in the cards, that would be something I'm going to sport. So there's a look into my personal life. Um, so a lacrosse ball can also be used on the bottom of the feet. So help keep those muscles healthy and happy, and do some release on your own feet, because those muscles end up getting really overworked throughout the pregnancy. Would a foam roller work too? As far as versus a lacrosse ball? Yeah, it can. If you're going to roll out your glutes, if you know how to do that, it definitely can. It kind of depends where, Danielle asked this question, and it kind of depends where you are in your pregnancy and how stable you are. A lot of times just rolling out your glutes on the foam roller, it's stressful on your pelvic joints. Honestly, we see a lot of people that when you're just on one side, it just puts a lot of torque on these joints. So I prefer the lacrosse ball during pregnancy, but if you're super stable and you feel like you have a good core support, you could use the foam roller too. Yeah, hope that answers that. Awesome. I want to go back to, so some early postpartum healing practices. What we find most is that a lot of providers suggest that at 6 weeks, go back to intercourse, go back to pretty much doing what you were before slowly and listen to your body. But that's just not that descript, right? You're like, well, how do I do that? And you might be in a hurry to like get back your prenatal weight or whatever it is for you, whatever your motivation is. And that's individual. And what I want you to know is that it is common in other countries like France to automatically get 10 visits for your pelvic floor and 10 visits for your abdominal wall, just to restore normal motion, restore normal strength. And what we end up seeing is the body is, in the US, that's just not the case. You really have to advocate for yourself to get your own postnatal pelvic PT. And what we end up seeing is moms that don't get help. You might feel fine, and that's what, like, you just had a baby. So of course anything is more fine than just having a baby. And a lot of moms don't really acknowledge that they have discomfort because we have a newborn and we are doing all the things just to try to survive. But what ends up happening is that, like, the 3-month mark, the 7th month mark, 18-month mark, the body starts to compensate, okay? And then you end up with your core not working for you. And if your pelvic floor is in a really tight fashion because it just spit out a baby, and now your body is working so hard to pull everything back together, then all of a sudden you don't have this healthy, happy muscle working for you as a force absorber. And what happens with that is that then you end up putting more pressure on organs, so bladder, uterus, rectum. So you can have more things like incontinence or farting when you don't want to be, or queefing, vaginal noises, those kind of things. And then also you get more joint pain. So hip, knee, back pain, because your core isn't working for you. And so we end up seeing that a lot of times. If we see it like within the first year or two, it's nicer because it either prepares you A, for another baby, or B, it's just easier to get rid of the scar tissue and kind of release those compensations. But it's never too late also. So if you're like, oh yeah, I know my mom pees her pants and I don't want to be like that, it's truly never too late. We see people that are 20 years postpartum and can still help them. So they might have already had like a knee replacement or their hip injection for their hip. And if their pelvis is corrected and their birth injuries are restored, so like scar tissue is released from the birth, if it was a C-section or vaginal delivery, then there's a lot of hope for getting that back, so your core can then function for you and be more effective as a force absorber for you. I have a massage gun. Can I use that? Yeah, Stephanie, I have to be completely honest. I don't know the research on massage guns and pregnancy. I know they cause a lot of vibrational forces throughout the body, and I just don't know the research. So I'm sorry I can't speak to that specifically. But yeah, I didn't think they were typically recommended, but I would talk to your OB specifically. Yeah. At what week do you recommend doing physical therapy? So I usually starting in the second trimester, 16 weeks is a good time, 12 to 16 weeks. And because then we can get a baseline for where you are and what you need. Some people need like a couple weeks of physical therapy and then just like monthly check-ins. Some people need 8 weeks of physical therapy and then spread it out till the end of their delivery. So it kind of just depends on where you are, what you're experiencing, how your body is. It's super individualized. But as far as what week to start, you start in checking pelvic floor and internal during the second trimester. We don't start any internal prior to during the first trimester, unless there's severe pain or an indication from a MD or OB. Yeah, 6 to 8 weeks after birth is the best time to start. So then you can get ahead of all the compensations and take care of everything, so that you know that your exercises you do are becoming more effective and most effective for your body to prevent any injuries or ailments later on. So here, body motion, like our main goal, and this is really where we want to collect research, I think I was mentioning that earlier, is in the changes you can make in the pelvic floor to really help optimize a vaginal delivery. Even if you are having a C-section, if you prep your pelvic floor, because C-sections affect the pelvic floor, they have the same fascial connections. So you still have to get pelvic floor PT after a C-section if you end up with a C-section. But even if a mom ends up with a C-section but has control of her pelvic floor or had pelvic floor PT during her prenatal prep, like if some emergency happened, her recovery is so much better just because she knows how to coordinate and use these muscles. And that's what's pretty cool. So, but we're also super passionate about helping people have vaginal deliveries, because the C-section rate in the US is crazy, crazy high. And definitely doesn't need to be that high. So in some states, it's up to like nearly 40%. In Washington, we hover around 30%, depending on hospital. But yeah, so hopefully we can mitigate that and reduce the C-section rate in America by pelvic floor PT. So the screen is some common symptoms that people experience. And again, these can all be addressed with PT, but I highly recommend anyone getting it preventatively to help prepare for birth. So yeah, I got a question in the chat that was, can you go through the bowel mechanics again? So how to have a healthy bowel movement. And I just want to talk through the sequence of that. So the sequence would be 3 nice diaphragmatic breaths. So doing 3, 1, and then on the third one, you hold the air inside your belly, and that's when you gently bear down to fart. Okay, so, or bear down to have the bowel movement come through. So that's like the gentle bearing down. So just bulging gently. It's not the straining. So there's a difference between the straining and the bulging. Hopefully that was indicated. Now, as far as pushing a baby out goes, we don't teach pushing with breath holding. So there are different patterns for pushing, and some people believe that there's no pushing should happen. You should just be able to have a reflex happen, and the baby just comes out. So it's whatever you believe. There are techniques in the research that suggest that breath holding is maladaptive for pushing, and so you should have an open glottis. So you should be able to push and breathe at the same time, like something like that. So we get into that a little bit more when we talk individually and kind of see what's going on with your body. So we can discuss that later on. But yeah, anyone else? You saw a video on using a band around your ankles. Yeah, Danielle, you would do that just until you feel a burn. So you can go side to side 30 times, but so you feel it in your hips, in your buttocks, I should say. So cool. You're welcome, Danny. Anyone else have any questions that they want to drop or anything they need clarity on other than signing up for a free discovery visit? You have nothing to lose. So, and just so you know, if you do decide to work with us, we do have different prenatal packages. So a lot of our patients will do like a prenatal nurture package. So getting your body ready for the first time you have deliver, and then prenatal tune-up package would be for someone who wants to prepare their pelvic floor and their pelvis for if they're a second-time mom or a second-time delivery. So that is that. Oh yeah, I didn't mention, if you're still on, join our Body Motion Moms group. You don't have to be a patient. We just would love to have you on, and we drop a lot of content there and just connect you to other moms. Holding your breath at any time is bad. Is that true? I would say don't breath hold. Yeah. Breath holding would be, I'm not sure what the context is, but breathing is best. So your blood is flowing. This was great. Valsalva. What do you want to know about a Valsalva? Are there any pressure points on the foot to avoid. So just under the arch is where you stay. So just right along the plantar fascia, under the arch of the foot, kind of where your support would be. The place on the ankle to avoid is that it's like right inside in the middle of the ankle, but you wouldn't get the ball up there anyways. Is bouncing on a ball doing any harm? No. When you bounce, just breathe. Kind of see if you can coordinate your pelvic floor with your bounce. Kind of fun. Pelvic muscle or. Awesome, guys. This is awesome. Cool, guys. Anyone else has questions? I'll stay on for another minute. But thank you so much for coming on, and we are happy to be a part of your journey. So thanks, guys.